Okay, so what is cold plasma? It is more correctly termed cold atmospheric plasma, which is an ionized gas that has only been recently extensively studied by researchers um, as more of a possible therapy in dentistry and oncology. There are very few studies out there that have been done on aesthetic applications for plasma. So when I say in my presentation, some of you guys have seen it or not seen it, a lot of you guys have gone through the training already. But when I say we are pioneering this field, we are truly pioneering this field. So it's really exciting. Plasma for aesthetics is still fairly new. If you are an esthetician and you're in the industry, you've been hearing about this for a few years, but mainstream hasn't really caught on to it quite yet. So there aren't any huge studies that have been done on plasma for aesthetic purposes yet. So what we have are our personal experiences, our before and after photos. That's kind of what we have right now. There is a study that was done a while back on some aesthetics, but they don't really apply. And I'll probably do some more presentations and education on that at some point. But today we're going to get more into the cold plasma. So there are several different gases that can be used to produce the cold atmospheric plasma. Helium, argon, nitrogen, just air that you breathe can be used, and then something called heliox, which is a combination of helium and oxygen. For PLAXEL purposes and most of these plasma pens, PLAXEL is ionizing the atmospheric gases, so basically oxygen. Oxygen is a combination of several different gases in very small quantities, but essentially it's using oxygen to ionize and produce the plasma discharge. Same technology in the pen is producing that cold plasma. We'll get into how it changes in a second, but in a nutshell, that's what cold plasma is and can be utilized or created. But there are many different methods which cold atmospheric plasma can be created. What has been studied as far as dentistry and oncology arenas is that these types of plasma can induce apoptosis, necrosis, which is tissue damage. Apoptosis is a cell death. It can cause cell detachment and senescence, which is not anything, none of these we have to really worry about with our plasma, and I'll get to that, the reason why. But these are more powerful plasma applications that are used in dentistry and oncology. So these issues can happen. So I've seen a lot in some of the groups, in the plasma discussion groups, about certain devices causing necrosis and tissue death and all of this stuff. With PLAXEL, the energy produced is so low that we don't have to worry about this. And if you hear of devices that claim to have more power and more, more megahertz, more all of the different terms that are used, what we're finding in aesthetics, not just in plasma, but in other types of applications, is that less is more. I quote a lot of, I'm going to draw a blank. Dr. Setterfield. I quote him quite a bit because he has been, he coined the whole microneedling movement, which is different than plasma, but in microneedling, he has proven that less is more through different studies. What we're finding across the board in aesthetics is that less is usually more. And what I mean by that is putting more energy into the skin tends to destroy more collagen than it yields or kind of cancels out. Dr. Ben Johnson talks about this too with lasers, and that you are creating collagen, but you're destroying collagen to create collagen. So your net collagen is like zero. So the one thing that is exciting about plasma is we aren't destroying a ton of tissue to regenerate tissue. So it is truly a less is more type of procedure. And I think the more mainstream gets in on this and does more studies, I think they're going to see that a lot more. So basically, energy is needed to produce and maintain plasma. There are super high energy plasma devices that are not advised for skincare, that are used in medical and like surgery and all kinds of other avenues that it's used in. And what we're dealing with is a lower voltage type of plasma that has been found to be very effective for skin. So with plasma devices, thermal, electric, or light energy can be used. So there are heat energies that can be used, electric, which most of these plasma devices are electric. They're using an electric energy to ionize gas, or they're just sending electricity through a pen and burning the skin. And we'll talk about that. Or even light energy is sometimes used to create plasma, not in the aesthetic world, but it's interesting to know about. Usually, the discharge needed to produce the cold atmospheric plasma is induced electrically. So a lot of these cold plasma devices that are out there that have the flat tip that you're seeing all the sparkly purple, that's being induced electrically. So oxygen's being ionized and that plasma is being created through the materials inside of the pen and then sent out of that tip. So each part of the pen, each part of the internal components and the tip are very important in the entire process of creating the plasma and introducing it to the skin. Because I'm a science nerd, and so I know a lot of you guys are too. There are a few different methods to produce the cold atmospheric plasma. So these are dielectric barrier discharge devices, which doesn't mean a whole lot. I'll get into it in a minute. There's the atmospheric pressure plasma jet, not to be confused with jet plasma. That is not the same thing at all, and I'll get into that too. There is the plasma needle and the plasma pencil, which are variations of the pressure jet plasma that I'll get into in a second. So to back it up a little bit, what exactly is plasma? I wanted to get into a little bit of the history to just give these two people credit for where we are today. William Crookes is a scientist in 1879 who did a lot of experimentation with plasmas and sending plasma through a tube, and he called it radiant matter. It was about 50 years later that Irving Langmuir came along. He's the one I talk about most, and he really coined the term plasma because this plasma energy that he was experimenting with reminded him of blood plasma and how the particles would move around in kind of a jelly-like state. So he coined this energy, this type of energy that he was experimenting with as plasma. I wish there was a better term for it because, you know, everyone gets confused with blood plasma and they think you're doing a vampire facial when you're not. Anyway, that's why I like to call a lot of what I do like plasma energy facial. For those of you that are wanting to call it something different, that's what I like to call it. Another esthetician that I work with a lot, she likes to call it microplasma, which is actually a medical term. So that's another thing you can call it if you're trying to get away from plasma fibroblasts, which is not really a term that I personally like, but figure out what term works best for you. That also depends on what you're allowed to do in your area. And if you have more questions about that, we can talk about that later, as far as FDA and what we are allowed to do and not do and say and all of that. So we do know that 99% of the visible universe is made up of plasma, which is really cool. Plasma is the fourth state of matter. There's solid, liquid, gas, and then plasma. So essentially there are two different kinds of plasma, the thermal and the non-thermal, the hot and cold, which is kind of interesting because non-thermal or cold plasma isn't always cold. It's just, it won't burn you. So sometimes you do feel a little bit of heat with it, depending on the device that you're using. But below a certain temperature point, it is considered cold and not thermal. Thermal plasmas are like lightning, which would fry you if you touched it. The hottest plasma that we know of is in the sun. So anyway, just some interesting facts from a science nerd to other science nerds. So thermal plasma has electrons and heavy particles, neutrals and ions, if you're into molecular chemistry, and those will be the same temperature, so they heat up together and create that hot plasma. With cold atmospheric plasma, it's said to be non-thermal because the electrons are at a hotter temperature than the heavy particles that are usually at room temperature, so that brings the temperature down to a place where you can actually touch it and it won't hurt you, or it won't cause any markings or anything. So again, I had mentioned the temperature point. So 104 degrees Fahrenheit or less is considered cold, which some of it, depending on the device that you're using, some of it can, if you hold it there, can leave a mark. The cold plasma we're dealing with is not going to leave marks even if you hold it on the skin. So this is more in reference to those medical devices. And again, there are several different methods of producing the cold atmospheric plasmas, and we're going to get into those right now. So the dielectric barrier discharge device is something that is used in medical applications mostly. It consists of these two flat metal electrodes that are covered with dielectric material. So it creates this ionization when the gas moves between the electrodes, and that creates the plasma. So there is a high voltage that is applied to one electrode, and then there is a grounded electrode. So we are not dealing with any of these devices that have to be grounded because we're not using that much energy. A very high voltage is required for these, and it's generally used for sterilizing living tissue, getting rid of bacteria. This eczema formation, yes, I thought was really interesting because that's actually combining different molecules of different species, but we're not dealing with any of that, but still interesting. Now, there is something called radio frequency plasma jets or atmospheric pressure plasma jets. Then this is not to be confused with jet plasma. So I thought it was really interesting that they decided to call themselves jet plasma when they're not a plasma jet, because an actual plasma jet, it has these electrodes, which, as you can see on here, it feeds the gas through those electrodes. So it's generally helium and oxygen, or it could be other types of gases, and they flow at a super high rate through the device to create the plasma discharge. So you generally have to be hooked up to some kind of a gas tank for these, and the plasma jet's not, or the jet plasma is not doing that. So it's just interesting they chose that name. We'll get into more of a comparison on their cold plasma and our cold plasma in just a little bit, because that's what we're getting so many questions about lately. So I do want to address those questions. And right now, if you are thinking of questions, type them into the chat so you don't forget them, because I will get to those. Yes, with these types of plasma jets, they generally have to be grounded because they are such high voltage. It's generally using helium, and it's generally used for sterilizing surfaces. The plasma needle that I mentioned and the plasma pencil are forms of these atmospheric pressured plasma jet devices, and they are generally very, very high intensity of energy that's going through these devices. So PLAXEL is not in the megawatts of power. It is in the watts. It's in watts and not megawatts. So it is a very low power device. And again, we're finding that more is not better necessarily. So if you haven't done this already, you want to make sure that you have this little brass chuck piece. Some people call it a chuck. The one that you'll have two of them that come with your pen. So this is the one that has the larger opening, and you have one that has a smaller opening that's for the needle. So you want to make sure and switch it out for the cold plasma tip. It goes in like this. So one thing that I thought was interesting with these radio frequency plasma jet pen or devices is that they were able to go from sending out this just jet of plasma energy, and they were able to modify their device to put a needle in it to make it a pinpoint precision plasma delivery. So that is what PLAXEL does. It has a few different forms of delivering plasma into the skin. So it has that needle tip, which is giving you a technically a jet energy of the plasma. And then it has the ball tip, which is doing something similar, but it is transferring the energy into the skin in a way that's not leaving a mark on the skin. And that ball tip we're using mostly for very, very superficial fine lines, not necessarily deep wrinkles, although it does have an application for those in combination with the needle tip. Then the third application that PLAXEL has is this cold plasma tip. So the cold plasma tip, as you can see, is a white tip. And why I like to use it on a couple of different modes. You can use it on continuous mode of 10, and you can also use it on pulse mode of 3. And the difference is that pulse mode is pulsating the plasma, and continuous mode is just continuously firing. So it's kind of like a higher frequency on continuous mode, and pulse mode is, again, pulsating it. So there are a couple of different ways you can do this. So if you played with it at all, you notice that you have to do it on clean, dry skin in order for you to feel it. If you're on pulse mode, you will feel it go. If you're on continuous mode, you'll just feel a continuous vibration. So depends on the person I'm working on, but generally I'm using it in pulse mode because when pulse mode, you're confusing the skin a little bit. What is happening? That's why a lot of these different vibration devices work so well, is because it's not this continuous delivery of energy. Your skin has to actually think about what is happening because it's this random pulsating. So that's why I like the pulse mode the best. You'll also notice that you smell ozone. So it does have a sterilization effect when you are using this tip. It will help to sterilize the surface, which is great for those who are acne prone. I have experimented a little bit with this tapping motion, but my favorite is dragging. You can use the cold plasma tip to do a lifting type of facial where you will literally drag and lift as you're doing a facial on someone, and you'll notice a light lift. And the more you do it, the more drastic it gets. We're seeing that you want to do at least 6 of them in order for your clients to really notice a difference. I haven't harped too much on the cold plasma application because I really like more drastic results immediately. So that's why I've taught mostly the needle tip. But now that there's more buzz around cold plasma, here we are, we're talking a lot more about it. My favorite way, I think, to use this cold plasma is to incorporate it into my facials to help the skin absorb more of the product in your active ingredients. So I like to start with my double cleanse, which is from Sunshine Botanicals. Is the most amazing cleanse that I've ever used. It's incredible. I won't talk too much about it, but I will start with that. I'll do, my hot towels, my steaming, whatever it is, extractions, the whole process of your normal facial, your mask, whatever it is that you do. And then I will make sure that the skin is dry and, of course, very clean after all of this, but dry. And then I will take and I'm about to do a demo for you too. So I'll have my model come in here in just a minute. I like to do small sections at a time and rub it in really well. Make sure that the client can feel it because, again, since it is, sorry guys. Anyway, I will do small sections at a time. I'll make sure that my client can feel it happening because it is a lower power. It is effective, but you want to make sure that they feel it because it is a lower power. I know I'm going to get a question about frequency. I have my frequency always on 150. I rarely ever change it, and 150 is the highest setting on frequency. So I always just leave it there. For my students who are on here, if you ever feel that your pen is getting hot really quickly, please let me know so we can do some troubleshooting because that should not be happening. I will do, again, small sections at a time, make sure they're feeling it. And then after I do one section, I'll apply my active ingredient. I'll do another section, apply that active ingredient, another section. So that is what I use it for most. Emily from Sunshine Botanicals and myself are going to be doing a lot of experimenting with this cold plasma facial. So stay tuned for even more education on protocols and tips and tricks and how many facials you should do and all of that. Before we get into demos, I wanted to talk a little bit about jet plasma and how it's different. I am hoping to be able to get my hands on a jet plasma at some point, but from what I've seen and from what students have told me that have both PLAXEL and jet, they feel like it's doing the same thing and has about the same power behind it. So you can rest assured that you're getting true plasma. It does the cold plasma as well, and you don't need to spend a lot of money on two different devices. What makes theirs a little bit different is the tip is supposed to wear out after so many uses, and ours doesn't do that, so that's good. I've tried to make this device as cost effective as possible, so I don't like to sell the needle tips and extra tips for an exorbitant amount of money. I don't think it's necessary. So the pricing that you guys are getting on like extra ball tips and extra flat tips are like maybe $5 more than what the manufacturer sells directly. And that's just to help me cover the shipping. So I don't make money on these, just so you know. But also make sure you never drop this because it will break. There is a porcelain piece in there that will break. So you never want to drop your flat tip. Jet, their tip has a certain type of a metal on the inside. And I was told that those little pieces of metal wear down after using it for so many hours or so many uses. I can't remember. But yeah, our cold plasma tip doesn't wear out. So that's awesome. And then there's another device I've been asked quite a bit about. I think it's called the Fusion, and it's a device that is like it has a box, and then the box is plugged in, and then it has two separate handles that are connected to this box with a wire. Each one of these hand pieces does something a little different. One of them is hooked up to a helium tank, and so it's a true jet plasma. I'm not sure exactly what she's using that for or claiming that it does, but a jet plasma is very good at sterilization. This tip is also great for sterilization, not sterilization, but killing bacteria. Sterilizing would actually require some heat processes in it. So I don't want to say the wrong term here, but sanitizing a surface you can do with this, as well as that true jet plasma with the helium tank. And she's also doing something interesting with her needle tip pen that we can also do. So she's doing this spray, or what I call the drag technique, and she'll put a needle in the end of this other hand piece and sort of just spray the face in sections. We can do that with our needle tip. In fact, we did this on my model just the other day. I want to bring her in here when she's ready because I want y'all to see the aftermath of it, because she also put our concealer on top of it. We did some dots on her under her eyes too. So you guys can see just how the makeup covers it. So any of you guys that have been to the live hands-on training, you have met this wonderful model. Her name is Laura. She's like my model for everything. But I might need to join on my phone here. While I'm doing that, I also want to answer some of your questions before we do our model. We're 30 minutes in. I'm trying to hurry. Non-PLAXEL pen states it uses oxygen and helium. Is that different than PLAXEL? So PLAXEL is using oxygen and not helium, so that is a difference. A device that's using helium, you don't have to use that. Oxygen can be used, and that's what PLAXEL uses for its true plasma application. So what makes something true plasma is there's a few different factors you want to look for. You'll see the purple spark. If you're using the needle tip, it'll be a true violet color, not yellow, not orange, and it's violet. And you'll smell ozone from that plasma discharge. You'll actually feel the plasma energy enter the skin, not just burn the surface. It does feel very different. If you tested different pens on yourself with PLAXEL, you know what I'm talking about. You actually feel it enter your skin. And the other thing to look for are those white dots. And that's how you know that the plasma is true plasma and it's targeted and it's going where it needs to. This needle tip with the PLAXEL, what it's doing is it's pushing away the stratum lucidum and stratum corneum, which are the top two dead layers of skin cells on your skin. Those are the two layers that don't have any moisture left. So the plasma is plowing through those layers and getting to the cells that have some moisture left in them and sublimating those cells. So with PLAXEL, we're essentially deleting a few skin cells at a time. And when you work on that really crepey skin and you're able to get a video like zoomed in of you working on that skin, and if you have really good eyesight, you can see this, but I find I have to zoom in sometimes to see it. You'll actually see the skin tighten just a little bit every dot that you put down. It's really cool. Sometimes you will see that effect with a skin burning pen because it's just burning. And you know, when you get a burn, you get tighter skin. So that's not necessarily an immediate effect. It's not. The true results come months later after the person has had a chance to produce the collagen and elastin. People that are posting these immediate amazing results, that's really just inflammation. I don't care what device you're using. Some people will start to see results in a couple of weeks if they heal really fast, but generally you're waiting, 2 to 3 months for those final results. If you're wondering where you can get the PLAXEL, get with Mike. You can find Mike on our main page at worldplasma.com. Just send a message through the chat or put your information in there and Mike will get with you very quickly. If he's not asleep, he will text you. He's awesome. Can you send us out a protocol? Yes, I can. Oh, Melissa, that's what you do is on pulse 3. Yeah, I like it on the P3 mode. Does cold plasma tip need to be replaced if there's a certain period of time? Yeah, it doesn't have to be replaced unless you find that you just can't clean it anymore, like it's stained or something. I haven't had that issue, but I would not put it into an autoclave. It could damage it, but you can clean it with alcohol. You can clean it. I wouldn't soak it for too long in barbicide. It can discolor it. I always clean mine with an alcohol wipe and make sure I get into the little crevice. I make sure that I get into this little crevice. I have these tiny little alcohol wipes and I'll just make sure and clean it really well. You're not going to be getting it soiled with blood, so you don't need to worry about sterilizing in the true sense of the term. Yeah, so the cold plasma tip, you can use it unless you drop it and break it, then you'll need a new one. P3, some of you guys feel that P3 is too strong. It really depends on your client and their comfort. So if P3 is too strong, you can turn it down. You can mess with the frequency. You can use it on continuous mode. There's so many different ways to use it. And there's really not a wrong way unless it's not working. Then, you want to make sure it's working. Does the pen need to take a break after a certain amount of time? Not really. So the old PLAXEL used to get really hot and I would have to give it a break after like 30 minutes. This one, I have not had an issue with that. So if you have a PLAXEL and it's getting hot, then let me know and we can troubleshoot that. How long should a treatment be done? I don't know how long it takes me to go through one, but I'll show you guys a little sample so you can see if you're worrying about time. Safe to use an enzyme in your facial? Yeah, it is. Just when you're actually using the cold plasma tip, you want to make sure there's nothing on the skin. Cold plasma can be performed as often as you want. It's not leaving marks on the skin, and it's going to stimulate collagen production. You can actually do it as often as you want to. Needle tip, different story. I would not repeat in the same area for 3 months at a time. Is there a client concern you would use cold plasma for over the needle? Yes. So those who have darker skin, cold plasma is better because it's not going to produce any hyper or hypopigmentation. If people don't want the downtime of the needle, that would be a good way to introduce the cold plasma tip because the needle tip, of course, has some downtime to it. The cold plasma is not painful at all. If you have people that are super scared of any kind of pain or they just don't numb well, cold plasma would be a good alternative. Do I have a protocol for this spray plasma? I have a few different protocols for that. That is probably going to be another Zoom. We're going to have to do another one for that because there's several different applications. You can drag it along wrinkles, even deeper ones, and there's a certain way to do that. And then it can be used, for a full face. It's mostly an exfoliation effect, but it does send the energy deeper into the skin. So it is stimulating collagen as well. Yeah, you can use a cavity wipe on the cold plasma tip. You can do that. And alcohol, I can never say that right. The alcohol wipes, isopropyl, is that right? Isopropyl. Thank you. I'm tired, y'all. Lots of kids don't help. The 70%, you don't want to use higher than 70% because it's not as effective, and I cannot remember why right now, but the alcohol wipes are just as good for sterilizing. Does it help with hair growth? I do not know the answer to that. How often, how many treatments? You can do it as often as you want. If you're going for face skin lifting, I would do at least 6, but you can also just incorporate it into every facial just for the purpose of infusing the active ingredients deeper into the skin. Yeah, and I don't know if it helps with hair growth. That would be some really good experimenting to do. I have not tried it for hair growth. Someday I will probably experiment with that, but I haven't yet. I'm seeing in another group that they are claiming the cold plasma or the device they're using is helping with wrinkles. Is that true? So it can help with wrinkles if you do it enough. It's going to take a lot of sessions to see a noticeable difference, but that's the whole reason why we're doing all of this, right? Is to minimize wrinkles. So if you are able to get a lifting effect with it, then yes, you're going to help reduce wrinkles. But again, you're going to have to do at least 6 facials to get that lift effect with it, which is why I like the dot plasma a lot more because it's quicker. And yeah, the cold plasma is not painful at all, and you can do it. You could do it every day if you wanted to. Yes, you can use it on crow's feet. On flaky skin, yeah, you can. You would want to use a very good moisturizer afterwards, and it will help the skin absorb that moisture a lot better as well. Other devices shown to stimulate hair growth. So yeah, we definitely need to do some testing on that. Yeah, I'm going to go with Emily on that because she and I are wanting to do a lot more testing on cold plasma. So let me connect my phone really quickly, and I'm going to have you guys look at Laura's skin real quick so you can see where we did a couple of different things. I don't know if you guys can see her. Well, I'm connecting my phone, but you can see where we did, you can barely see it on the screen, but we did her dots under her eyes. And then we did this dragging on the top, which is going to peel. So if you're going to do the drag technique, their skin is going to peel. So they're not getting the dots and the crusting, but they are going to peel because it is a thermal application. So, but you can see that she's got the makeup on top of it, which covers a lot of it until they start getting flaky. Then of course it's going to look flaky no matter what, but it covers all the redness. While I'm connecting my phone, I'm going to have her tell you about the carboxy mask. If some of you guys were on that call, you know what I'm talking about, but it's another really great tool in the healing process. So I'm going to have her talk about it for just a second.
Okay, so we decided to try the carboxy gel treatment to see if it would speed up the healing with the plasma. So immediately after doing plasma, I put the carboxy gel treatment on for 45 minutes, and it took away the redness. As soon as I took the mask off, my face was no longer red. I also feel like my dots have dried out faster this time. So it seems like it's speeding up the healing. Because we did this on Tuesday, I think, and it seems like my dots are going to start falling off already. And usually it takes me a good week before they fall off. And then after they fall off, we will do some more treatments with the carboxy mask, like every 3 days until we've done 4 masks, and take a series of pictures to see if that helps plump it up more. enhance the treatments of the plasma, because we've done plasma on my face and on my eyes 4 times now, I think. So
Yeah.
we know how I react and what the results are. So this will be a really good experiment on how well the carboxy masks helps the healing and enhancement on the plasma.
All righty, cool.
Okay.
Okay, I am going to. Did you apply carboxy gel with alpha hydroxy acid after needle plasma?
With what?
AHA, alpha hydroxy acid?
No, just the
No.
carboxy mask.
Just the carboxy mask. So on some people, you'll notice a lifting right after you do one facial. But usually they are not going to notice until after you've done several, and it's different for everybody. So because she's got that makeup on and we already treated the top half of her face, I'm not going to treat that part of it. I need to get my. Also, cold plasmas have been around for a really long time. Like this cold plasma facial application has been around for a few years. So anyone claiming that they're the first to do it is not true. I wouldn't even say that I'm the first, because there are some other devices that do it. But not all devices do the true plasma with the needle as well as the cold plasma. I don't know of other devices that do that yet. Okay, pulse mode on 3. So real quick. You makeup on everywhere?
Yeah.
Okay.
Sorry.
You know you're only supposed to do makeup on half of your face, right?
I didn't know what you wanted done.
Yeah, who does that?
I know, right? I was like, I'll just take a chance. She wanted my whole face done.
Yeah. Okay, so this is my microtonic by membrane. I just put it in a disposable bottle in case I get something on the bottle, so I can keep it clean. And of course, normally I would do a full double cleanse, but I am not going to do that today because time. You guys don't need to see me do an entire facial. But I am going to record all of that for our online training that's for students only, and I will add it and you won't have to pay extra for it. So that's something that's really cool about World Plasma, is we like to teach you everything that you need to know. I don't like to say, oh, you want to learn this technique, you're going to have to pay this much more. I don't like that. So we're going to see how well she responds to doing the lifting technique. We're going to do that on one side of her face. Then we'll sit her up and see if we notice a difference. Some people will have, again, an immediate difference. Not everybody will. So you can either hold the button down, get your finger tired, or you can hold down this joystick here, and you'll see that the display goes light, and then you push that trigger button, and then you'll get this green light that stays on. Y'all can see that. That means that you don't have to push the button anymore. It will just discharge. So if you have a needle in there, be really careful, because right when you get close to something, that plasma will come right out. So I'm gonna make sure that I can feel this. Yeah, I can feel it. We're friends, so we're not doing everything like you're supposed to. Like I haven't tied my hair back, so we're besties. It's okay.
Yeah.
So when I'm doing a lifting facial, I like to incorporate the neck. Some people like to upcharge for that. I like to incorporate it because they're just going to be happier. And when you drag this across the skin. I'm going to make sure it's dry, but you're also going to drag it and hold the skin with the other hand so that the skin is taut. Can you feel that?
I can feel you dragging it.
See, I can feel it vibrating. She can't ever feel. And this is where you'll just experiment with different settings.
I can feel that now.
You felt that one?
Mm-hmm.
Oh, okay. So for her, I have to make sure that skin is very taut. I'm going to slowly drag it across. I'm going to do 2 to 3 passes on each stroke or each area that I do. You don't want to apply a ton of pressure. You just want it to be very gentle. And I always go in an upward motion. And it's very relaxing. They'll feel a little bit of vibrating. And you'll smell ozone. You smell ozone?
Mm-hmm.
Yeah. The base should feel a little bit of a vibrating, and you will also feel it from holding the pen, and you'll feel it in your other hand where you're stabilizing. And Mike, if you're on here and you see any questions that you can answer, you can jump in if you want to.
Okay, sounds good. I'll take a
I don't
look
know if
through
he's still on
the
here.
questions here.
I think he is.
I think I can hear him talking.
I see his name on there. Again, I'm going to do 2 to 3 passes on each spot. Since I'm not able to do her entire face, I don't know how much lifting we'll see, but we're going to try it. Some of our students have been able to get a really cool video of their tips sparkling in low light. I haven't done that yet, but I think Rachael Burnham has done it if she's on here. Thanks for that video. It was really cool. Is there any sound from this pen with this tip? No, I don't. Do you hear anything?
Mm-hmm. It has a little bit of a buzzing.
Little bit of a buzzing sound.
It's very low though.
A very low buzzing. I can't hear it because I'm deaf. Like I'm literally deaf. But she's telling me that she can hear very low buzzing.
It's mostly when it gets closer to my ear. So like when she's over here, I don't hear it very much.
I'm just doing a little bit extra because I don't get to do the rest of her face because we already plasmaed her face the other day.
Keep me young looking.
Hmm?
Keep me young looking.
Yeah. That's the goal, right?
Mm-hmm.
So after I've done this direction, I like to do another upward lifting direction. So I'm doing kind of a crisscross pattern. And hopefully this gives you guys kind of an idea of how long it would take to do. It's really not super long. Doesn't take a long time to do the whole face. You see me like start and stop a little bit just because like I'll stop feeling the vibrating and then I want to make sure it's still vibrating.
Rachel, we had a question. Somebody was asking, how long after using the needle tip can you perform a cold plasma treatment?
You could do it as soon as the dots fall off. Good question. And I actually know some people, I don't do this, but I know some people that will use the cold plasma tip and drag it across the face quickly before they apply numbing to help the numbing penetrate better. The numbing I use is TKTX and it's so good that I'll just massage it and scratch it into the skin. And it works super, super well. Laura here has had an electric device treatment before.
Mm-hmm.
It was a lot more painful, right?
Oh, yeah.
So Deborah's asking, how do you incorporate the cold plasma with your hydrofacial?
With hydrofacial? Oh, that's
Yeah.
a good question. I haven't even done that yet, but you could do that right before you do the booster, but you would have to make sure to do it after extractions and get any serum that's on the face. Like if you're using the glycol peel, you got to make sure you really get it off the skin and dry the skin before you do the cold plasma. And then that's where I would do it, is between extractions and any other serums that you apply. Alrighty.
Another question we had is, how much do you recommend charging for a cold plasma facial?
So I charge, let's see, I do $195 for an hour and a half if I'm including the cold plasma. I call my facials custom facials because I just make them custom to each person. But if I'm incorporating the cold plasma, I'll do it for $195 for an hour and a half. Okay, let's have you sit up. Let's see if we notice anything. I'm not sure if we're going to notice any lifting because we only did a small portion, but we'll look. Check this out. Look at me real quick. Without turning your head. Just look straight at
For
me.
my body.
Yeah, so do you notice a very slight difference? Not a ton, but I haven't done a lot of cold plasma on her. We've done mostly dot plasma because that's what we've been testing the most, but I gotta get right in front of you. Yeah, so I noticed a tiny bit of lifting right in here versus the other side that we didn't do, especially on the neck, just a tad. But this is, after this, I would put my active ingredients on so that she'll get the most absorption from this ingredient. So I'm going to show you guys the technique that I use most often for infusing products. So go ahead and lay back down. Let me use some vitamin C on you.
Oh, yeah.
Oh, yeah.
Vitamin
So you need some vitamin C serum.
That's some good stuff.
Yeah. Okay. Yes. So the one that I really like is Sunshine Botanicals. It's called Brightening Moisture Fluid. And this is a vitamin C. She now calls it vitamin C plus brightening moisture, something like that. She changed the name to emphasize the vitamin C. So when I'm purposely using this to infuse products into the skin, I like to do one little section at a time. So I will do like just over here, for example, do a little circular motion, make sure you're feeling the vibrating, smelling the ozone. You feeling vibrating a little bit? Okay. Do a small section. And then a little bit of my serum. And then I will do another section. You want to be careful not to get serum on your tip. And I'll do that all over the face. Some people like to draw a grid. I don't. I can just tell where I've gone. But if you like to draw a grid with like a white eyeliner pencil, you can do that. I also don't do that because I'm trying to keep their skin really, really clean while I'm doing this. So and also I was going really slow on that lifting. You don't have to go that slow. You can go faster. I just like to be very relaxing in my movements because all my facials are super relaxing. I incorporate massage. So I'm used to moving a little slower. But
So we had a question.
yes.
Does it help with does the cold plasma tip help with refining the skin with acne scars?
I would use a needle tip for that. I don't think cold plasma is powerful enough, in my opinion. Maybe after doing several sessions, but I would much prefer to do the needle tip for that. But you guys get the gist of how this works. So maybe sit up one more time. Yeah, I noticed even more improvement after adding the serum in. I don't know if you guys can tell, but I can see it in person. But that'll be even more dramatic the more that you do. So these cold plasma facials are really going to build on the previous one. So each time you do one, it's just going to be better and better. It's kind of like the same reason I do cryofacials. Each one builds on the previous one. And there are some people, they like to do packages of custom facials where I incorporate the cold plasma with cryofacials. And for some people, I like to incorporate microchanneling with it. It just really depends on the person. So I talk a little bit about incorporating different types of treatments and red light therapy inside of our online training. How far in between to get results? 2 weeks. Yeah, if you want to see some good results with the cold plasma facials, I would do them 2 weeks apart. What I really like to do is I like to get people on this plan of come see me once a week for 3 or 4 weeks, and we'll see how they're doing as we go along. But when I first get started with someone, I want them to come see me every week for at least a month so that we really ramp up that collagen production quickly. And then we'll taper off to every other week. And then eventually we go to once a month for maintenance. That's true for my cryofacials and my cold plasma facials. If we do microchanneling, I always do that 1 month apart, every now and then 3 weeks, depending on how aggressive we are. But I do like to gear people up to doing the needle plasma. I don't like to jump into that as my first line or my first treatment with people. I like to get their skin ready first. Let's see, any minimum time before or after ProCell? Yeah, so you could do cold plasma like the day before you did ProCell if you wanted to. Afterwards, you just want to make sure their skin is not sensitive anymore, and then you could do another cold plasma facial if you wanted to. So if you're just doing like a 0.25 a couple of days later is probably fine. If you're doing a 0.5, they might need 3 or 4 days. If you're really sensitive, you might need 5 days. But as long as your skin's not sensitive, you can do another one. I want to make sure I didn't miss anything. Have I tried full thighs and legs? Not with cold plasma. I just do that usually on the face. I feel like we would need a more powerful device with a bigger tip. And I say more powerful because your skin on your body is just thicker. It just needs different things. Erin has been finding that the ball tip has been great for keloided acne scars. So that's really cool. I haven't experimented with that. That's something that is so cool about this community is we have like Erin, who's a nurse, we have nurses, we have nurse practitioners, we have doctors, we have PAs, we have so many different kinds of people, lots of estheticians, lots of medical estheticians, lots of people using this device and discovering new things all the time. So as some of you guys know, my time is very limited right now with having twins last year. No, they're 19 months now. Oh my gosh. And I also have a 4-year-old, and I run 2 companies with my spa and World Plasma. So a lot of you guys know how limited my time is, and a few years it won't be like that. I'll get to do a ton more experimenting, but our students are finding out some crazy awesome things. Like, and another example is I've always said, don't work on tattoos, don't work on permanent makeup with plasma. That's not what it's for. But I had a student recently who removed a couple of hair strokes on some microblading help. And she was successfully able to remove a couple of little hair strokes that client didn't like. So that was amazing. I would normally tell you not to do that, but she had success with it. And maybe it's because that pigment was very superficial and the plasma acted more like an exfoliation type of treatment. I'm not sure. So that's just something we have to explore more. Again, we are pioneering this field of true plasma. So it's really exciting to be one of the first to get involved with this, especially with PLAXEL, because we do know that it is true plasma and it does these things that true plasma is supposed to do, that we're all told that it's supposed to do. If you guys have seen my masterclass, I talk about that, how when I got started, I was given a device that just burned the skin. And I was so disappointed because I was told one thing and it did something completely different. So that set me on my journey. Ended up buying a PLAXEL, and that was before the true plasma version came out. So I think it's funny that I trusted the manufacturer a second time, knowing that the first device I bought from them was not really true plasma, but they upgraded to true plasma. I bought another one. And as I was filming a training, I was literally working on an orange and filming it with the new PLAXEL, and it wasn't doing the same thing as the old one. So I started working on my skin and I was like, oh my God, this is so different. I have to reshoot like half of my training now. And I had started my training because I had so many requests for people to that needed good plasma training. So that's why I originally started it. And I was like, oh, I'll just figure this thing out as I go. And then I got this true plasma pen, and you know, the rest is history. We recorded a lot of that training, and that's what you guys see when you log in. For those of you that are students and you haven't seen the extra video section of training, make sure you go look for that. If you don't have access to it, please let me or Mike know, because there's so much additional videos in there, extra techniques, extra training. Anytime we discover something new, that's where it goes, and you get free access to that. Those of you that aren't students yet, that's how it is. I don't charge extra for extra training unless it's hands-on. That's different. We have a group of amazing trainers now all over the country, and we don't have a trainer in every single state. So if you're interested in being a trainer, reach out to me. We can talk about that too, because I'd like to have one in every state eventually. With that said, the online training, anytime I add to it, you have lifetime access to it. So you don't have to pay extra for that ever. And we tried to, again, keep our costs down low so that everyone could have access to this true plasma. So I'm so excited about that. Oh yeah, Denise, you. What else? I want to make sure I get all these questions. Yeah, hair growth application. We definitely need to research that. So any of you guys who want to get us started on researching hair growth, let me know, and we can possibly do a study together. That would be exciting. Oh, thank you, Megan. So Megan is saying that I'll read this out because it's such a sweet compliment, and I love it when I hear this because it helps me to know that I'm doing something right. And I really, really want this to be the best training in the world. I really, really want that. It's my goal. So Megan is saying, you're doing a phenomenal job based on other training I've received. You have surpassed the expectation with your professionalism and your availability and encouragement. Keep up the great work. Thank you. So my students know that I will answer my phone even if my kids are in the bathtub. And I use that example all the time because I have literally done that. I will answer my phone even if my kids are in the bathtub, and I will answer your questions. I work late at night, so anyone who's got questions can always ask me. I'm talking to people in the UK a lot. We're in different time zones. So I have a male and female. I am doing hair and brows on for hair growth that I will share the progress. Oh, okay, Leslie. Awesome. Awesome. Yes, we would love to hear that. And we'll promote you too. Do you do training on microblading? I don't right now. That's something I'd like to do someday, but I just don't have the time right now. I just don't. But someday I will. A friend of mine who's also a phenomenal microblading artist, she and I want to team up and put together a kick butt permanent makeup training that is going to be better than anything else out there. But our goal is to actually get more requirements. We're in Texas, and there are, like a lot of places, no requirements for training on permanent makeup. It's under the tattoo license. You just buy the license, you take a bloodborne pathogens course, that's it. And that's really, really scary. Way less of a requirement than an esthetician, and an esthetician is not allowed to draw blood. So go figure. So she and I are hoping to petition the government and get that all changed and come up with the most kick butt permanent makeup training that you've ever seen. So someday we will do that. World Plasma students are always so pleased with the training and support we have received. Yeah, thank you, Megan. You're so sweet. Thank you. Thank you, Petra, for joining from Australia. Thank you. Good to see you. Thank you, Kimberly. Parva, you're so welcome. Did I miss any questions? If I did, unmute yourself and ask away.
Just a quick question. Yes. I've been working with the Monster and I've been having issues with it. Tell me if you have any experience with the Monster, and what would you compare it to the PLAXEL? Mike has been calling me a lot and sending me emails, and well, he stopped for a while, but I'm looking into, because I was wanting to try the Beauty Monster first. So tell me if you have any experience, if you can tell me what have you found it to be better. And I'm not trying to do a comparison. I'm honestly trying to provide a better service for my clients.
Gotcha. Yeah. So I don't personally have a monster and I have not worked with it. The videos that I have seen with it show me that it is an electric pen and that it's just doing the burning dots. So that's very different than what PLAXEL does. So I don't have tons of advice on that specific device. Oh, what?
No. It is usually that's what it is. A lot of people don't tell you because they're scared, retaliation. But you working with so many people, at least giving me an idea that there are some issues, and I'm looking forward to seeing if I could work with the PLAXEL. I still looking out your training. I love your vibe. You give me such a zen feeling, so I love it. Thank you very much.
Oh, you're so welcome. And feel free to just reach out to us, get in contact with Mike, and he can get you in touch with me if you want to talk more on the phone. I'd be happy to get on the phone with you and answer more questions. Did anybody else have anything? If you want to unmute yourself or just type in the chat.
I'm truly interested in how often do you recommend to do cold plasma? You said like you recommend in the beginning every week, like 3-4
Yes.
times, and after this repeat every month. But
yeah, so it depends on how your client is responding, how their skin is responding to it. So if you start noticing some drastic improvement after doing it 4 times every week, then I would move to every other week and do maybe 2 or 3 of those every other week, and then skip to once a month for maintenance. But really just watch your client's skin, see what it's doing, if it's responding, if it's not, and then just change your technique accordingly.
I have a training. I'm sorry, my English. I have a training for fibroblast, and they recommend to do it minimum 6 months apart. And also, I specialize in an anti-aging treatment, and mostly women, they have loose skin. Does cold plasma help with this?
Does it help with what again?
Loose skin. You know,
The
like
loose
aging,
skin.
especially like neck. Truly big problems with age, it's the neck.
It does help with that, but the dot plasma with the needle is way more effective for that.
I'm sorry. How many shots? Okay, if you use needle, how many shots you do? How a lot shots you can do on some spot?
On sunspots, cold plasma?
Yes, because I see some pictures. It was like practically covered with the spots, and it's rehealed for months. It's not like.
Yeah, I generally like to do the needle tip on the sunspots to treat them that way.
And you can
some of
repeat
them,
in 3 months?
Well, some of the sunspots, depending on if they're deep or superficial, the really superficial ones come right out. But if they're a little deeper, they may take a few treatments before they resolve.
Okay, thank you.
You're welcome. And what exactly does this do? Stimulate collagen? Yes. Cold plasma is helping to stimulate collagen. Yes. Did anyone else have any questions? The numbing that I use is called TKTX, and you can find it at worldplasmashop.com. That's the numbing that I use. Just be mindful that it is not legal everywhere. I'm in a med spa. My medical director is okay with it. So just make sure you check on that.
And as far as your aftercare, like the aftercare, do you guys are thinking about making maybe a line for aftercare, something that you know formulation wise it would work specifically? I would be excited about a bundle.
Yes, so we partnered with Sunshine Botanicals, which is my personal favorite skincare line right now. Sunshine Botanicals has put together a wonderful aftercare kit for us. Those can be, I think they can be purchased on the shop site. I can't remember. Yes, they can. They're there.
Okay, great. Thank you. I will look at it.
Also, if you want to get them cheaper, then I'll need to get you in contact with Sunshine Botanicals, and they can offer wholesale pricing. I can't offer that, but they can. So I can if you need that, want that, get in touch with us and I can get you connected with them.
Awesome. Thank you very much for the partnership. It's important. You know,
Yeah.
but the problem
You're
is
so
everybody
welcome.
wants to get in it, but not everybody, you know, have the knowledge, certification, experience. And I'm just happy that you're able to provide that. Thank you.
You're so welcome. Yeah, the funny story with Sunshine is Emily, the owner, burned the crap out of her hand because she didn't listen. I would just tease her because I'm good friends with her, but she burned the crap out of her skin. She just like held the plasma like super long on each dot. And I don't know why she thought she was supposed to do that, but I know I don't teach that. So I don't know where she got that, but she burned the crap out of her hand. And I have this really good before and after comparison where she treated herself with her products, her Sunshine products, and her hand was completely fine in 5 days. I was shocked. I was like, that, I want that. So we did some testing and created an aftercare kit, and that's what we have now. And it's amazing. I love it. And you're so welcome, Kimberly. Oh, got a question about the tyrosinase inhibitor that I like. To use to test the skin of the client. Okay, so I only use a tyrosinase inhibitor if they're above a Fitzpatrick 3. I will automatically use it. Some people use hydroquinone. I don't like that because hydroquinone poisons the melanocytes, and we're not trying to poison anything. So I really like the Anti-Age brand, their brightening serum for pre-treating. And for some post-care, for some people will need that too. I especially use it on those that did not react super well to the spot test. So I do a spot test with, this is all with the needle behind the ear, and I'll do a significantly high power, probably 7 or 8. And I'll do, you know, several little dots behind their ear, and we do it there just in case they scar from it. And then, you know, it's in a place where nobody's going to see it. It's not on their face. So I spot test everyone, even my Fitzpatrick ones. Some of them are prone to hyperpigmentation and they don't know it. Most of them do know it, but I spot test everybody. So if they do give you a little bit of pigmentation issues after 2 weeks of healing and it's not significant, then I'll do the tyrosinase inhibitor with them. I'll have them use that for 3 to 4 weeks, and then we'll do the treatment. And then once the dots fall off and they've used all their aftercare, then I'll have them do more of that brightening solution just in case. But if we do a spot test and it is like very apparent that they hyperpigmented or hypopigmented, they're just not a candidate. I won't touch that. It's just too risky. So hopefully that answers that question. Megan, I'm surprised at how many practitioners do not spot test. I am very surprised too. I really, really harp on this to spot test every single person, even if they are Casper white. You just don't know. And a lot of people don't know because they don't get a lot of different skin treatments. So they don't know how they're going to react. So spot test every single person. I talk about that in my training too. But Maria, you're so welcome. So did anyone else have any other questions? I really hope this was informative. I am tired, so I know I was probably jumping around everywhere, but I think I got everything in that I wanted to. How long before you spot test? Not sure what you mean, but I'll do a spot test. If someone's interested in plasma, I say, all right, let's do a spot test. We'll do a spot test and I'll wait at least 2 weeks and check it out and see how it healed. And then we'll decide whether to continue or not. I hope that answered your question. But again, I like to do some other treatments before I do plasma, just to really ramp up their collagen production, get them in a state of healing before we do plasma, because it is a little bit more aggressive. So I want to make sure they're fully prepared for when we do it. I also have them take some extra vitamin C, and I also like the beauty blend supplement sometimes, but what's the other one? Arnica. Mm-hmm. Having them take Arnica 2 weeks prior and vitamin C is a perfect combination to help the skin heal from within a lot better. So
And
Thank you, Claudemar, for being here.
are we gonna
And,
follow up with emails to all of us with some further information from you and your classes? I'm just eager to receive information.
Yeah, are you wanting more information about our device and training?
Yes, all of the above.
Okay, yes. We will send out, another email as a follow-up. Absolutely. And for Fitzpatrick 5, is it safe? The middle, so the higher Fitzpatrick, I would not do the needle tip past a light, like very light 5, and that's with, they pass that spot test with flying colors. Ball tip and cold plasma tip are safe on all Fitzpatrick. Anyway, we've been on here for a while, so I'm going to say good night. And if you have any other questions, please get on worldplasma.com if you're not already connected. Enter your information, and Mike will get with you, and he can schedule a phone call with me and you as well. If you guys want to talk on the phone with me, I'm totally open to that. Might hear my kids in the background, but that's okay. So Yana, you're welcome. Thank you all again for coming on tonight. Have a wonderful evening, and we will chat soon, I hope. Bye.